Hello and welcome to this tutorial. This is what we're going to do with a bit of neuroanatomy. We're going to start with the peripheral nervous system, particularly the cranial nerves. Okay, so the spinal nerves are accounted for in a separate video. So we're going to get right on with this. Alright, so basically the CNS is made up of the brain and the spinal cord, and then the nerves that extend from this brain and spinal cord are what you're calling the peripheral nervous system. So this includes the nerves, both from the cranial nerve aspect and also the spinal nerves. So we said that the CNS has the brain and the spinal cord. That means that the nerves that are going to be extending from the spinal cord, we're going to be calling them spinal nerves, while those extending from the those that are extending from the brain, we're calling them cranial nerves. So in this video, we're going to actually focus on the cranial nerves, basic structure of the cranial nerves, and the function as well. So that's the PNS division. Basically, the PNS can have a structural division and also a functional division. Okay, structural division is one where we say we have the cranial and spinal nerves, and function division is where we are saying we have afferent or sensory or efferent motor neurons. Okay, that is basically what we are saying. So there are going to be 12 pairs of cranial nerves. These nerves are paired, 12 pairs, and their names indicates the area that they supply. So the name kind of gives an idea of what area is going to be supplied by this particular nerve. So one other thing to know about it, these serve mostly the head, but there's some exception, especially for the vagus nerve, which is going to supply most of the GIT, including some areas of the heart as well, just most of the thorax and everything. So that is basically what that is. So the first two cranial nerves, first two are going to be arising from the forebrain, while the remaining 10 are going to be arising from the brainstem. So if you check properly, the first two, which is the olfactory number 1 and the optic nerve, are going to be coming from the forebrain, which is this region here, and then the rest of them are going to be coming from that region that we specified, the brainstem. So that is what we have to know. Structural and functional division, take note, and also the fact that some are purely sensory and some are purely motor and some actually mixed. So you're going to find nerves that have mixed functions, which means they carry both sensory and motor fibers, and you're going to have some that are purely sensory, some that are purely motor. Alright, we're going to discuss and know which ones they are by using a simple mnemonic. Alright, so let's get right into the cranial nerve. So cranial nerves, here I'm going to go through each cranial nerve and its function, and then end with the mnemonic. So I'm going to just go over quickly through these and just mention a few details that are maybe important to know for each particular cranial nerve, and then we're going to end with the mnemonics that help us tie everything together, of course. So cranial nerve number 1, or the olfactory nerve. The olfactory nerve, olfaction, the sense of smell. These are sensory nerves of smell, of course. So these ones are going to extend into the this area known as I don't know if this is quite visible. Let me try to zoom in. There's this area known as the cribriform okay, that is the cribriform plate. That's just on the roof of the nose, so to say, on the roof of a nasal cavity. Not really on the roof of the nose, but on the roof of the nasal cavity. And then we have what is known as olfactory epithelium. That means the epithelium that lines that particular area is sensory. Okay, it has olfactory receptors. And then the special thing about this particular nerve is that it's known as what is known as a first order. Okay, I'll just try to clear that. So it's known as a first order sensory structure. The reason why it's called a first order sensory structure, I'm sure you'll find some question based on this. This is because you have the sensory receptors going direct into the nerve. Okay, the olfactory receptors are actually coming from synapsing directly into the nerves themselves. Most of the structures that you're going to find that you have receptors. You're going to find that you have receptors, and they're going to have like a lot of connections before you get to the actual nerve that takes it to the brain. So this one is considered like a first. It's considered as a first class, okay, first class kind of arrangement, because it's the receptor and the actual nerve. These are more like one structure. It's like just one extension from the olfactory bulb. Okay, so that's just the terminal end of the olfactory nerve, the olfactory bulb, then extending directly into the receptors here, the receptor epithelium. That's most like there's a very intimate connection, so to say, between the olfactory nerve and the receptor portion. Okay, so that is one special thing about this particular nerve. So moving on, you now have the optic nerve. Optic nerve, from the name, it has to do with optics. Anything to do with optics, that's eyes. Okay, eyes, sense of sight. So this is going to give innervation, of course, to the cone, the rod cells, the ones that are responsible for sensation of light in the retina. That's where you're going to have that particular arrangement. But the thing of interest that I have for this nerve is the optic chiasm, or chiasm. I don't know how you pronounce it, but the optic chiasm. Optic chiasm, what it does basically is that you are combining visual fields from the left and right eye. So you have let's call this according to my side, this is the left eye, and that will be the right eye. So these are going to see, like, obviously they're going to see slightly different things, okay? But then the brain has two halves. The brain has two halves, so the brain is usually on top like that. So the brain has two halves. What you're going to see is that you have the left and right half. These halves of the brain, they're usually more like mirrored, because your body has a left and right side. So the brain is mirrored based on that as well. But most of the structures, you find that there is what is known as crossing over, in the sense that at the end of the day, you find that the right side of the brain controls what is on the left. But that's not really my point. My point is that there is what is known as an optic chiasm, which is if you go back to a chiasm in terms of crossing over and gametogenesis and everything, you find that that's just crossing over of those chromosomes and everything, so they exchange genetic material, so there is variability in the offspring. But here in this case, the chiasm is for one purpose. That is, if you're sending visual information to one area of the brain, that area needs to have both the visual field from the right and from the left. That's the basic idea. So what is going to happen in the chiasm is that this nerve is going to come from here, okay, the optic nerve from the left and the optic nerve from the right, okay, they're going to meet there. And once they meet, okay, the medial fibers, that means the fibers that are closest here, okay, the fiber that are closest on this particular end will cross over into the other side, okay? So let's call this the visual center. Okay, the visual center is somewhere here at the back. So visual center on the left here and on the right here. So the ones that are medial will go into this side, like the opposite side, while the ones that are lateral will like continue up to the visual center like that. So that means you have this the left eye sending its visual field or its field of view both to the left and the right side. Okay, that's basically what's happening. So for the other one, let me use a different color so that it's even much better to distinguish. So for the one in red, for the one to the right, it's going to come as well. The medial fibers, that means the one that are closer to the center, they are going to cross over into here, the other side, or the ones that are lateral will just continue there. So this area is what we're calling the optic chiasm, where there's a crossing over of the visual optic nerves. And then once you have a combination of your left and right visual field or optic nerve fibers, you're going to have now what is known as an optic tract. So that is going to be called an optic tract. That's an optic tract. But here it's the optic nerve. Okay, and then this is like the visual field, the visual area. Sorry. Okay. With that said, we'll move on. That is basically the only thing that I have to talk about. So this is a diagram that is just expressing what I was trying to draw here. All right. Other than that, we can move on to the other nerve. That is oculomotor nerve. So from the name oculomotor nerve, that means ocular, something to do with the eyes as well. Motor means something to do with the muscles. So this nerve has to do with the muscles of the eye, basically. So it innervates 4 of the extrinsic eye muscles plus a few other muscles that we mention here. So the branches, we have a superior branch. This nerve, the oculomotor nerve, has a superior branch and an inferior branch. So once the nerves come in, it has a superior branch and an inferior branch. And what you're saying is that the superior branch is going to innervate what is known as the superior rectus muscle. Superior rectus. So superior branch for superior rectus muscle. Okay, superior rectus. And then the other muscle is the levator palpebrae. Okay, this is the muscle that raises the eyelid. So there's a question that you can find in the MCQs that says which nerve is responsible for elevation of the eyelid or for opening the eye. So you're going to put instead of saying the superior branch of the oculomotor nerve, you can just say cranial nerve number 3, okay? Because that's usually the option, because they don't really ask you in terms of superior branch, inferior branch. They ask you in terms of CN1, CN2, or CN3. So that is how they're going to be asking you. So they might say which of the following nerves is responsible for controlling the opening of the eye. So that's cranial nerve number 3, because the one that the superior branch, which has a innervation to the levator palpebrae muscle. Okay. With that said, the inferior branch is the one that is going to innervate the medial rectus, the inferior rectus, and the inferior oblique. Okay, inferior oblique, inferior rectus, medial rectus. These are also 3 of the important and extrinsic eye muscles that help in movement of the eye. Okay, and then another thing is that it also sends autonomic motor axons to intrinsic muscles of the eyeball. So autonomic motor axons, that means for those actions that you cannot control voluntarily, like for example dilation or contraction of the pupil. So that is controlled by the ciliary muscles and also the circular muscles of the iris. That is the sphincter papillae. When the ciliary muscles contract, you're going to have dilation of the pupils, while when the circular muscles of the iris contract, you're going to have like constriction of the pupil, something like that. This will be further explained in the eye senses. That's where most of this is explained. But just know that innervation, for that to happen, comes from the oculomotor nerve. That means the nerve that is responsible for the muscles in the ocular or the eye region. All right. So this is a picture just showing you exactly what I was just from saying. So oculomotor nerve comes, you have a superior branch there, and then exactly what I'm just from saying, but just in pictorial view. So another another muscle that innervates the eye. So the eye is innervated by three muscles, basically. Sorry, the eye is innervated by three nerves that control much of the muscles that are here. And then these, we can talk about them while skipping just one nerve that is in the middle. So for the third cranial nerve that we are from talking about, the fourth cranial nerve, and the sixth cranial nerve, they are going to be targeted towards the eye, okay, but just different muscles in different areas of it. But then when you look at cranial nerve number V is the one that we're going to go over after we've talked about this. These ones that are dealing with the eye. So the trochlear nerve is specifically dealing with the superior oblique muscle. Okay, so the trochlear nerve innervates the superior oblique muscle. It's also an extrinsic eye muscle. The reason why it's called extrinsic is because it's outside the eye. An intrinsic muscle is those smooth muscles that are responsible for contraction of the lens and also the iris as well. Those ones that you can't really control voluntarily. And the smallest of these cranial nerves is the trochlear nerve, of course, that we're talking about, is the smallest of the cranial nerve. That's one feature that is interesting about this trochlear nerve. They might ask you in MCQs, which of the following cranial nerves, or which is the smallest cranial nerve? Trochlear nerve, cranial nerve number 4. Okay, and then how do you know that cranial nerve number 4 is the trochlear nerve? The mnemonic that is coming at the end of the video obviously it's going to tell us that. So it wraps around the pons, and then it exits from the posterior aspect of the brainstem. This is the only one that that is going to arise, or it's going to exit from the posterior aspect of the brainstem, and it wraps around the pons. So this is something that they can be asked in MCQs as well. So please take note of this. It exits through the superior orbital fissure. Okay, that's just an area which it exits from. And if you can see the same picture that we're from talking about here, this is the orbital fissure, superior orbital fissure that is somewhere there, just a fissure, or rather an opening in the bone that is in the orbital area, okay, for the eye socket, that is. Then we're also going to talk about the obtuse nerve, obtuse or abducens nerve. This one is specifically for the lateral rectus. Okay, lateral rectus. Find a way to just memorize these things, because memorize these. So the lateral rectus muscle is going to be innervated by the abducens nerve, which is cranial nerve number 6. Okay, and that's basically the the reason why it's called abducens is because it's involved in abduction of the eye. The reason why it's called abduction is because it's lateral rotation. Abduction, remember, it's rotating a particular thing away from the median. So if you rotate an eye, there are people who can do it at the same time, like the left and the right eye, like going different directions. But for a normal person who can't do that, if you just rotate one eye to the left, well, let's say the right eye, you rotate it to the right. That means it's abduction, okay? Abduction. And then the muscle that is responsible for that when it contracts is the lateral rectus muscle, and then you're calling that the abducens muscle because it performs abduction. So the name kind of coincides with what it does, where it innervates, just like I said at the introduction of this video. The trochlear nerve already mentioned, and then I was talking about the abducens nerve causes abduction. So then we're going to talk about the trigeminal nerve. Trigeminal nerve, the reason why it's called trigeminal is because it has 3 branches. Tri from 3, geminal, I don't know where they got that, but it has 3 branches, and then it innervates most of the face, sensory innervation to the face, basically. So it's where most of the sensation for the face. And then it has like 3 branches: V1, V2, and V3. Forgot to put it 3. V3, and they have the name ophthalmic, and V2 is maxillary, while V3 is mandibular nerve. Okay, so the largest branch is the mandibular nerve, or the mandibular branch rather. Sorry. And how you can know that? I mean, not how you can know that, but I mean, in case this is also very subject to MCQs. Which of the trigeminal nerve branches is the smallest in size? The ophthalmic. Which one is the largest in size? The mandibular nerve. And which one is intermediate? That's of course the maxillary. But then just take note again of which area they innervate, or rather which area they supply sensation to. That's the ophthalmic. That's the upper part of the face, basically the upper part of the face. And then the maxillary, that's the upper jaw, around the upper jaw. And then the lower jaw, you're dealing with the mandibular nerve. So areas around the lower jaw, like somewhere here, that's the mandibular branch. The maxillary branch, we innervate areas on this particular area, while the ophthalmic will bring innervation to this part of the face. So V1 there, V2, and V3 on the bottom there. That is how the trigeminal nerve works, supplies its sensation to the different areas that it's supplying its sensation. Okay, and then we already talked about the adjacent nerve, cranial nerve number 6. Then I'm going to go to cranial nerve number 7. Cranial nerve number 7 is the facial nerve. Okay, the facial nerve is basically innervating the muscles of the facial expressions. These muscles include, I don't think you can be asked about this, but the orbicularis oris muscle, the mentalis muscle, and the depressor anguli oris muscle. Okay, so maybe just memorize 1 or 2 from here in case you are asked which facial muscles, in case one of them shows up and they ask you which nerve innervates that. So at least know these. And then these are muscles that help you make facial expressions. The orbicularis oris muscle, that is like on your, that is around the mouth, basically it helps you make a facial expression, whether you frown or anything in that nature. Facial expressions, that's the facial nerve. Facial nerve for the facial expressions. It also innervates the stylohyoid, digastric, and stapedius muscle, but these, for your coverage, as for now you can just leave it out. And it innervates more named muscles than any other nerve in the body. So this is just one thing again to know about the facial nerve. The facial nerve, which cranial nerve, or which of the following nerve innervates more named muscles than any other nerve in the body? You know that's the cranial nerve. So now that you know, keep that to memory for MCQ's sake. All right. Then cranial nerve number 8 is the vestibulocochlear nerve. Vestibulocochlear nerve. There are 2 words there: vestibule and cochlea. This is somewhere to do with the ear. So vestibular branch, we innervate the vestibule, which is responsible for equilibrium, balance. Okay, while the cochlea, that's for hearing, a branch for hearing. So that is about that. And then then the other nerve is the cranial nerve number, okay, I skipped from, all right, cranial nerve number 9, glossopharyngeal nerve. The glossopharyngeal nerve, from the word glosso, and pharyngeal. Glosso means, wherever you hear glosso, it means tongue. Okay, so it's going to do with innervation to the tongue. Pharyngeal, pharynx, of course. Okay, so this nerve brings innervation to the tongue and parts of the pharyngeal apparatus as well, the pharynx. Okay, so it innervates the posterior third of the tongue, proprioceptors from swallowing muscles, okay, because they are in the pharynx region, of course, and then there are also baroreceptors in the carotid sinus, and chemoreceptors of the carotid and aortic arteries as well. These are also innervated by the glossopharyngeal nerve, and it innervates the external ear. Okay, this one is important. So if you were to get away with any 2 points here, the external ear, the posterior third of the tongue, and the stylopharyngeus muscle, which assists in swallowing. These ones are very important. And also it also provides autonomic neurons that stimulate the parotid gland to secrete saliva as well. Those are important functions that you're going to have to know about the glossopharyngeal nerve. Moving on, this is exactly what I'm talking about, glossopharyngeal, and it's giving you exactly where it's innervating on this diagram here. Then if we move on to the vagus nerve, this vagus nerve, it's a mixed sensory and motor nerve that wanders in the thorax and abdomen, and that's where the vagus kind of comes in, because it's a wandering nerve, because that's where it gets its name. So it lies medial and posterior to the internal jugular vein and the carotid artery. So just a detail to know where it's found in case you're looking for it, but I don't think you can be tested on that. Just know the function and you're done. And then these are like the extra fibers that it innervates, because the vagus nerve is a wide nerve, so it's going to have these sensory, motor fibers and autonomic fibers innervating different area, like the skin of the external ear, a few taste buds of the glottis and the pharynx, the proprioceptors of the muscles of the neck and throat, the baroreceptors as well. And then the motor fibers are going to be innervating the pharynx, of course, for the swallowing muscles, the larynx, that is for the speech, of course, and then the soft palate, that is just above and posterior to the hard palate. Okay, autonomic nerves will be innervating the GIT tract, the smooth muscle, most of the structures of the GIT, like I said already, and it has parasympathetic effect on the GIT and the heart, which means it decreases the heart rate. The vagus nerve decreases the heart rate. Stimulation of the heart by the vagus nerve decreases the heart rate. They can ask you that in the MCQ as well. Okay, moving on. We are now this is sorry, excuse me. This is like a diagrammatic representation of what I'm just trying to say, basically. So the accessory nerve, cranial nerve number 11, innervates the trapezius muscle and the sternocleidomastoid muscle, but the main muscle is the trapezius muscle here. But mention both just for safety. No, both just for safety. That's the accessory nerve. Usually, it used to be called the accessory spinal nerve. All right. There we go. Cranial nerve, the last one, the hypoglossal nerve. Remember when we said anything to do with the glossal, and it's the tongue. So hypo simply means below, or hyper, above, below, normal. But in this case, hypoglossal means below the tongue. So below the tongue. So this runs inferior to the tongue and innervates the tongue muscles and conducts nerve impulses for speech and swallowing, so that the tongue is able to move the way it does when you are talking, and also helps in swallowing as well. That's the hypoglossal nerve. All right, so now that we have talked briefly about the functions of these nerves, let's talk about how to remember them, how we're actually going to remember them. So you can know the functions here and there, but then if you ask cranial nerve number 8, because that's the way that they ask them, they don't ask you the hypoglossal nerve does this and that, because obviously you're going to know the function. So they just say cranial nerve number 8, what does it do? Or maybe in relation to cranial number 8, the following are true. You know how your mind asks your questions. So how we're going to tackle that, it's through mnemonics, of course. Mnemonics, my favorite part. So mnemonics on the names and the function, whether it's sensory, motor, or both. Okay, that's what we're going to deal with here. So for the names, the mnemonic is only one of the two athletes felt very good, victorious, and healthy or happy. Okay, you can put healthy or happy at the end there, depending on how you want to remember it. So only for the olfactory, 1 for the optic, and then 2 for the oculomotor. Off for the oculomotor, trochlear and trigeminal. And then A for the athletes, which is the abducens, and facial, vestibulocochlear, glossopharyngeal, vagus, and the accessory nerve and the hypoglossal nerve at the end there. So there are those which have like two letters, like these ones, that are usually confusing. These ones are the ones that are usually confusing because the letters are following up, and how do you know which one comes first? Okay, so for the first three O's, this is how I would like you to remember it. You have one nose, so that means olfactory comes first. Then you have two eyes. That means the optic one is the second. And then the oculomotor just comes along here as the third. The oculomotor comes as the third. Okay? So that's how you're going to remember which one is in this order of the three O's. You have one nose, two eyes, that means olfactory, optic, and then the other one that remains is the oculomotor. Then for the trochlear and trigeminal, in the word for, you have an O, similarly in the trochlea, and then in the word 5, you have an I, which is also in the trigeminal. So that's how you're going to remember these as 4 and 5. Okay, and then just know the vagus as 5, the 10 X, then that means everything else should fall into place for this particular mnemonic. Then for the function, the mnemonic that you're going to have to know is, some say marry money, but my brother says big brains matter most. Okay, so anywhere we have an S, that's sensory, S for sensory, M for motor, and P for both. So that means cranial nerve number 1 is purely sensory, cranial nerve number 2 purely sensory. Then cranial nerve number 3, it's motor, like the oculomotor, it sends innervation to the muscle. So if you check these and then you counter check, as you read these, you counter check what you're from defining in the previous slides, you're going to find that they're now going to be correlating, they're going to be adding up. Okay, but that means it's both. That means the trigeminal nerve is both. Then if you check, just for example, trigeminal nerve number 5, we said it's part, that means it's both. If you got back to the trigeminal nerve, you're going to find sensory innervation to the face and motor innervation to the chewing muscles. Okay, so if you check these, they coincide with what we are from saying, and that should make sense for the rest of everything as well. That is how it goes down there. Other than that, that is the end of this video and the mnemonic to help you remember the cranial nerves and a bit of their function. Okay, other than that, that's me signing out.